Welcome to another episode of A Doctor's Journey, and today we're going to get comfortable having uncomfortable conversations. We're going to be talking about research in Black and Brown communities, and actually where we stand right now and what the future looks like. So, currently, the FDA has standards for diversity in clinical trials because everything has to look like the population that it's going to serve. That may not always be the case, because minority groups are not the first to put their hands up in clinical trial. But let's take a step back and let's talk about what is research, and let's talk about why it's not new. Everything from the medication that you take for your pre-existing condition to the products that you put on your face over the counter at Walgreens has all been tested. That's all research. That's a part of clinical trial. All studies have a life cycle. There's that phase one where it's like an interventional, all the way to like a late phase or a real world evidence where we're looking for, okay, we know what happened during clinical trial. Now let's take a look at what's happening in the population. At some point, you have to be willing to put your hand up and be a part of change. Be a part of what's affecting you, your family, and your community. Now, we've been skeptical, and I talked about this previously in our very first episode. What if your scientists look like you? What if the discussion included a language that you can understand? Are you more open or more receptive to that kind of research? Now at JFP Consulting, we'll mostly focus on non-interventional research. So you won't be asked to take anything and be monitored for any drug, but you definitely want to share your experience because we have a responsibility. And the responsibility is to make the future brighter than the one that we had. And if we're going backwards, then we won't be able to achieve the goals that we've set out for ourselves. The pandemic has been heavy on us, and I've had lots of messages and lots of comments and lots of questions, and I've answered them to the best of my ability. But let's just say we weren't going to do research and we were just going to let the virus run course. Where would we be today? And sometimes you get a little bit skeptical because you feel like scientists don't know what's going on. And that's not true. I remember in the very, very early phase, Moderna was the first one to actually come up with the compound, the vaccine. But it had been tested for many, many months to make sure that the dosing, safety, and efficacy all aligned. Now we have the product and there's more skepticism. But we haven't been skeptical about anything else that we've been taking. Now, let's move forward. We know what COVID-19 looks like. We know how to treat it. So the language that we use will change. And sometimes you will hold scientists' feet to the fire and say, you said last year that the COVID-19 is ABC, and now you want to say this year that it's XYZ. Well, science is ever changing. It's always evolving. We are always learning new things. And as we learn new things, we actually bring that information to the public. So it's not deceit. It's not that we don't know what we're doing. But every time we learn something scientific, we then create an hypothesis for what's next. For example, if we were to study what COVID-19 looked like molecularly, then we may run another study to see what it looked like in certain population based on race and ethnicity. We may run clinical trials to look at it across age, gender. And this way we can bring you more specific information. So don't think scientists can't make up their mind and they're always giving you a different answer every 2 days. You just have to be open to the fact that science is an evolving process. Things are going to change. And as they change, you have to be able to adapt for survival. Thank you for watching this episode. There are plenty of opportunities for you to get involved in research in your community through JFP. I'll continue to partner with institutions looking to do ethical research in minority groups.